What is autoimmunity? That's the topic I want to start with today because I had a consultation this afternoon with a 33-year-old female who already has three autoimmune disease diagnoses. And her diagnoses were celiac disease, lupus, and Sjogren's. And the celiac disease, she'd been diagnosed with for 10 years, the lupus 5 years ago, but she said she had symptoms for 5 years before they figured it out. And the Sjogren's diagnosed 1 year ago. And so I was speaking with her, and because she's got three autoimmune diseases, and with having three autoimmune diseases suggests that your care hasn't been great because you've continued to collect autoimmune diseases. And as I talk about in my book, The Autoimmune Answer, you can find it on Amazon. All autoimmune disease is the same thing. Okay. Medicine says that there's over 100 different autoimmune diseases. And that is technically correct because autoimmune diseases are labeled by the tissue that is being damaged. But in actuality, there's only one autoimmune disease. Because what autoimmune disease is you have self-tissue. Okay, and that might be a thyroid in Hashimoto's disease. That might be an intestine in Crohn's disease or celiac disease or ulcerative colitis. It might be a brain in PANDAS or multiple sclerosis. It might be a parotid gland in Sjogren's disease. It might be, a liver in autoimmune hepatitis. There's lots of different tissues and organs that can be damaged, but essentially the disease is named after the tissue being damaged. So the self-tissue target is the victim. I give this analogy in my book as well. But the real perpetrator in autoimmune disease is the immune system. Actually, let's do it like this. Make it more memorable here for your brain. Is the perpetrator in autoimmunity is the immune system. So autoimmune disease is literally the immune system shooting at a self-tissue, okay? And so medicine basically listens to your symptoms or listens to listens to the victim, okay, crying out, and that crying out is symptoms. So you present with symptoms, and conventional medicine gives you a medication to basically duct tape over the victim's mouth. So the medication is going to hopefully, or their goal is to reduce the volume of the crying out or reduce the symptoms. However, you'll notice that nothing happens to the perpetrator in conventional medical practice because they're not focused on that. Their whole focus is symptoms, and being focused on symptoms has them focus on the tissue being attacked. And the reason for that is in conventional medicine, their sole focus is the diagnosis. They want to label it because once they label it, there's an algorithm that ends in a drug, and selling the drug makes money. But if our goal is, success and healing and prevention of a collection of one, then two, then three, then four different autoimmune diseases, we need to tackle the perpetrator. And to tackle the perpetrator, requires figuring out what's driving the immune imbalance. If you can tackle the perpetrator, then you no longer need duct tape because the victim stops crying out, right? Because we're no longer attacking self-tissue. So autoimmune disease is immune system imbalance, and that immune system imbalance is driven by all kinds of different factors that are usually lifestyle or environmental. Sometimes there's genetic contribution, but the lifestyle and environmental exposures play much larger roles than the tiny little genetic contribution. And because there's no drugs to, optimize your lifestyle or clean up your environment, those things aren't addressed by conventional medicine. They will love to blame genetics because if it's genetic, there's nothing you can do about it. So here, take our medication to palliate you until you die and be a lifelong client, right? So I hope this clears up a little bit for you, or was somewhat of an aha moment that, my communication to this young woman was, hey, you've collected 3 autoimmune diseases in 10 years. You're on medication for it. You're not improving. Maybe it's time that we start to focus on what really matters here. And hopefully you don't collect more autoimmune diseases, and maybe we can quiet down the screaming by these different victims.